Two peaks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's read and shine. Games and challenges, excitement in the air.
Liposuction, tummy tuck, BBL. There's been a lot of buzz around these topics over the years. Most we thought this can only be done by celebrities, but in recent times, the modern woman wants to look good. But many a times you still think that in plastic surgery, this is the only things that are involved, but there's so much more that is to be covered under that topic. Today, we are so lucky to have someone who will be telling us more about that. And before I give them the chance to introduce themselves, I'd like to appreciate the sponsors of today's show, Grace Park Medical Center. We will put all the information about this hospital in the comments and also in the description box. Karibu sana, Daktari.
Yes.
If you could be so kind to introduce yourself.
All right. I go by the name Dr. Matwa Christopher. I'm a consultant plastic reconstruction and aesthetic surgeon.
Yeah.
And at the same time, I'm a lecturer at the Kenya Methodist University, the School of Medicine.
Yeah.
And that's how I found myself in Meru.
Yeah.
Yes.
Karibu sana. How are you liking Meru so far?
So far, Meru has been very welcoming.
Yeah.
The weather here is not so bad.
Yeah.
I can deal with it.
Uh-huh.
Yes. And the people are warm.
Yeah.
Yeah. And especially here in Grace Park, where I spend some of my private time, the team here is awesome.
Yeah.
Yes.
Like I've mentioned in my introduction, I know people are really waiting for us to touch on liposuction and stuff, but if you could maybe broaden a little bit on plastic surgery, because especially us women only know about the lipo and all that. Yeah, maybe you can touch on the things that you do.
Yes, actually, it's let me give a short story.
Yeah.
I got into plastic surgery.
Yeah.
I was working in Western Kenya, and then I was an intern, and then we came across these patients who had chronic wounds.
Yeah.
And somehow we used to, debride, take care of the wounds, but closing the wound was like, we didn't know what to do with the wounds. So I was like, I think I need to find a solution, to that.
Yeah.
Then I was told at the University of Nairobi, they're offering a plastic surgery course as a master's course in medicine. So I enrolled for the course.
Yeah.
At the back of my mind, the main reason I joined was to become a wound care specialist.
Yes.
And then when I got into the program, of course, once you get into the program, the first thing you're introduced to is wounds.
Yeah.
Right? You're introduced to burns, you're introduced to other complications and malformations. Then as you're about to clear, you come across this whole world of cosmetic surgery, which is part of plastic surgery.
Yeah.
So plastic surgery, basically, it's two-pronged. There is reconstruction, and then there is the cosmetic bit of it.
Yeah.
Yes. So reconstruction basically is making something which is abnormal normal, right? Restoring function. For cosmetic, it's something which is normal, but someone doesn't like how it looks like.
Yeah.
So you're making it better.
Yeah.
Yes.
Now, if we could tackle a little bit on the reconstruction, which is also called corrective, right?
Yeah,
The
corrective surgery. Yes.
This is also what covers maybe someone is involved in an accident.
Yes.
I'm trying to see if we are getting it,
Yes,
we also pride ourselves of being an educational program. So
Yes.
I really want them to get what that is.
Yes.
Yeah.
Actually, sometimes we've had cases where, unfortunately, someone got the hand chopped off.
Yeah.
Those chaff cutter accidents.
Yeah.
The reimplantation, that's mainly part of what we do as reconstruction, right? Road accident victims, when you have a lot of what we call extensive soft tissue loss, like degloving injury. You find someone was involved in an accident and this whole arm, there's no skin. So we are the people involved in that. That's corrective surgery or reconstruction.
Yeah.
Yes.
And so far, you don't regret the career you chose?
No. No, actually, it's very satisfying.
Yeah.
It's one of those surgical modalities where actually patients appreciate what you've done for them.
Yeah.
Yes,
Yeah.
they come to my inbox, they send me messages. Some clients I operated on as long as 3-4 years ago.
Yeah.
Up to now, they're like, Doctor, really appreciate what you
Yeah.
did. Yes.
Yeah.
Yeah.
Hey, and now let's get into it. Liposuction, tummy tuck.
Yes.
If you could maybe distinguish, are the two the same or what's the difference?
No, they're not the same. Okay. Liposuction just comes from two words.
Yeah.
Lipo
And
from lipid, okay, like fat, and then suction is, just suction. So
yeah.
basically, just removing fat, right? And then tummy tuck, just as the name says, you're tucking the tummy. Tucking something is compacting it, making it tight. So basically, it's like you have a loose tummy and you want to make it compact, tight, and good looking. But before, a couple of years ago, actually, what was recommended was you can't do the two procedures together. You either start with the tummy tuck, then you do the liposuction, or you do the liposuction, then you do the tummy tuck later. But of late, with advanced technology, we're able to do the two procedures together. But it's good to understand that there are two different procedures. And if it comes to pricing, we'll still price it differently. Yes, yes.
Now with lipo, you said it's suction. So does it involve? It involves like you have to cut, or what exactly happens when it happens?
Yeah. Now, liposuction, you're from head to toe, you are fat.
Yes.
All right. So a client has to be specific where they're not happy with the fat. Okay. Now, there's something I need to mention. Sometimes I get clients, they come to me, they're like, Doc, I want to lose weight. All right. And then, can you do liposuction? I'm like, no, that's the wrong approach. Liposuction is not for weight loss, it's for body contouring. If you want to lose weight, there are bariatric procedures for that, dieting and exercise. But liposuction targets specific body parts. Someone will come and say, I don't like how my chin is looking like, right? So you just liposuction that area, right? Some come say, my arms are big, I don't like how they're looking like. So you remove fat there. Some come say, I don't like how my tummy is looking like. So even the tummy, again, it could be the front, the sides, the back. Okay, those the things they call the love handles, yeah? Yes. Some come and say the thigh, some come say the calf, all right? But you cannot come say liposuction me from head to toe. No. It doesn't work like that. But most of the time, over 90% of clients when they come, the issue is the fat in the tummy. Yes, so that's the one we do most of the time, liposuction of the tummy. It could be regional, just the front part. It could be 360, like the front, the side, and the back. Yes, and then we contour nicely.
What informs the decision of if you're doing a tummy tuck or you're doing a liposuction?
Um, Now, one, it has to come from you, all right? Like you look at yourself and you feel you need the service, and then two, it should not be dependent on what people are talking about you. Okay. The reason I say that is because if you come to me, you say, so and so is saying my tummy is big. Okay. Now, and then I go ahead and do the procedure. The success of that procedure will depend whether the other person will still say whether your tummy is big or not. Now, if I do it and they still insist the tummy is big, then it means I failed. All right. So it has to come from you. You look at yourself, you feel I need this procedure because it will help me look better. All right. And, again, I need to point out, it will not revive marital issues. Okay. Because I've been down that rabbit hole. Someone thinks if they do cosmetic procedure, it will revive things in that setup. Still not an indication. Actually, if someone comes and tells me, oh, blah, 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 my husband doesn't like my tummy, I'll not go ahead and do the procedure. Because the success of the procedure depends whether the husband is going to accept or not. Yes. So it has to come from you. Okay. You look at yourself, then you say, I need my tummy this way. So that once we go through it, I take you through the steps and the realistic expectations, then the surgery will be a success. Yes. So that's the determinant number one.
So what
Okay.
you're saying is that you really even go deep into checking
Oh
the
yeah.
patient's mental
Oh yes,
aspects.
yes, 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 yes. We must, as in you can't come show up and then the following day.
Yeah,
No,
just do
no,
it.
no, no,
I,
no, 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 no.
no, I have the money. So
Yes, I know, I know.
yeah,
Actually, when I'm having that conversation, I don't ask the questions directly.
yeah,
All right,
yeah,
but I can deduce from
yeah.
the talking whether where is the need for this procedure coming from.
Mm-hmm.
Now, uh, to determine whether you need liposuction or tummy tuck or both depends with the amount of excess skin that you have. All right. For people, because now the tummy, the abdomen is made up of three layers. There's the skin, there's the fat, and there's the muscle. Now, if your skin is of good tone and the muscles are good tone, it's just that you have this stubborn fat which is not going away, then you are the right candidate for liposuction. Okay. Now, if you have excess skin, excess fat, and your muscles are flappy
Yeah,
or they're not well toned,
yeah,
then you're a candidate for liposuction and tummy tuck or just tummy tuck. Yes.
yeah.
Yeah. So that's how I look at it. So you have to come, we talk, I assess, and then I'll let you know that, look here, if you do liposuction alone, it may not give you good results because I feel you have a lot of excess skin.
Yeah.
Or you have good skin, there is no stretch marks. This one, if you do liposuction, you'll get, all right. Yes.
And how soon, let's say now you've had the patient, you've done, let's say, lipo, what are the risks?
That's why we screen, right? So that we look at the risks, because there's what we call patient risks and then there's what we call surgical risks.
Yeah.
You as a patient, I will need to know whether you have another medical issues with you. Are you hypertensive? Do you have any other chronic medical issues? Have you ever had anemia, low blood level? Are you a smoker? And I'm very specific with marijuana because I've had issues with patients who smoke marijuana.
Yeah.
Do you take alcohol? All right. Or are you on any kind of therapy? All right. Are you like, there's some drugs when you take, especially if maybe you are on anticoagulant therapy. If I take you to theater, you may bleed a lot. So these are the things I ask just to ascertain, even your age itself. As a lady, once you get to above 45, 50, the hormones begin to change, and the many systems in the body, the cardiovascular system, but many things change. So those are the questions that we ask to gauge, okay, the safety, how safe you are to undergo the surgery. Have you had surgery before? Are you allergic to anything? So those are the things we ask, okay? Now from there, we assess the risk, all right? There's a score we give, all right? It's called a Caprini score. Yes. So for me, that's the one I use to assess the safety, the patient safety. All right. So then once, if maybe your score is high, then I'll let you know, look here, because of ABCD, I feel this surgery, can't do it right now until we take control of one or two issues. Okay. Two, after that, of course, you have to do screening test. We need to know your current blood level, your electrolytes, your renal functions, your coagulation profile. There are many things we do. If you're doing liposuction, remember it's a blind procedure. Those cannulas, when you take them there, it's under the skin, so I don't see. I don't see the cannula. But there's a way we trained. We use both our hands. At any time, you have to feel where the end of the cannula is. If you don't feel the end, then no, you're in the wrong place. Okay. Now those I call surgeons risk. Okay. So that's why it's important to know who is taking you through that procedure. Yes. So the thing is, you have to do an ultrasound. Okay. Just to be sure that the tummy, like, there's no opening or weakness somewhere, or if it's there, then you take the necessary precautions. Yes. If there's a hernia and you didn't screen, your cannula will go to, the hernia, there's some intestines protruding into the skin. So if you didn't know that as a surgeon, you go with your cannula. Yeah, yeah, exactly. So that's why you need to screen the patient. All right. So once you're sure you've asked the relevant information, you've screened. All right. Then now you can tell your patient, look, according to everything we've talked about, you're safe to undergo the procedure. Okay. If you have low blood level, I'll let you know, look here, because of low blood level, we need to postpone this until a time when your blood level is at a level that it's safe. Or you tell the patient, look here, we can do this, but we need to transfuse, and taking care. Then of course now you go into the procedure. All right, you do the procedure. I like doing my procedures under general anesthesia. The patient is asleep. It gives me peace of mind. Okay, and also because some of these procedures can last as long as 3, 4, 5, 6 hours. Okay, so if someone is awake after like 1 hour of lying down, your client will be like, "Doc, I'm tired. I need to turn." All right. So that's why I prefer doing them under general anesthesia, so that the patient is comfortable. I'm also comfortable, and I have enough time, enough peaceful time to do my procedure. After the procedure, of course, the reversal. Now comes the recovery period. All right. Yes. Liposuction itself, a good number of clients have told me it's painful. Some actually tell me it's just some discomfort. So the pain scale varies from client to client. But compared to like when I do a breast lift or reduction or whatever, I think liposuction is slightly more painful, right? Uh, Tummy tuck, the same thing, slightly. So there are things you watch. You watch for pain, okay? You watch for infections. Those are there are things we call acute complications. Like for instance, when I do a major procedure, I never leave town for the next 24 hours or 12 hours. Like if I do a procedure in Meru, I'll be in Meru today, I'll leave tomorrow. So that there are those acute complications that may arise, and you should be there to take care of them. Okay. Like for instance, the other day we did a procedure, then the patient went to the ward, then after a few hours, we had a hematoma whereby a small vessel opened up and then it bled. So we had to go back and close it up. So you can imagine you do the procedure and then you disappear. It can really complicate. So as a doctor, you need to be there for your client. Yes. So those are the immediate complications, all right? Like a vessel can open up, all right? You can have infections, okay? Pain, I've talked about pain. So those are things you need to take care of. Then there are late complications, all right? Now,
Yeah.
so there are those immediate complications. They can arise from the surgery itself, or they can arise from the anesthesia.
Yeah.
All right.
Yeah.
So those are things that you need to be around.
Mm-hmm.
Okay, at least 12 to 24 hours.
Yeah. Yeah.
Once you're out of that window of 24 hours, then you know your patient is quite
Is okay.
stable.
Yeah.
So whatever else that happens much later, it still can be taken care of.
Yeah.
Yes.
Yeah.
So I prefer keeping my clients in hospital, okay, especially after a very major case, for like 2 to 3 days,
Yeah.
and then they are safe to go home.
Yeah.
So to prevent infections, we give antibiotics. Pain, we give painkillers,
Yeah.
and there are also other supplemental medications that we
That they
give for
take. Yeah.
management. Yes.
Yeah.
Um, Risks, things have happened. Okay, I'm sure people read and they see all these things. All right. For instance, you hear someone perforated, the intestines, all right, or someone bled too much, or stuff like that, or there's other things that happen, like liposuction is a manual thing, and if you apply too much friction, you can have skin burns. Those have happened, which means you can lose some part of the skin. Yes, and then there's something else we call seroma, like because when you're doing liposuction, there's a fluid we inject before we suck out the fat. It's called tumescent fluid. So some of it, like most of it, comes out within the first 2 to 3 days. And for me, what I do, if I do liposuction, I put a drain so that you are comfortable, and that drain collects the fluid. All right. Not all surgeons do that. That's something I do, so the client sleeps comfortable. After that, if there's any more fluid that collects, it's called seroma. We just aspirate it out. It's a painless procedure. And then, of course, there is now the other aftercare like lymphatic massage. There's a lot that goes on. Yes, it's an intense kind of surgery, so that's why we don't just rush into it. These are things I have to tell the client to understand.
Okay, now you're done with the surgery, the patient has gone home. What are some of the things that they have to do, and especially the recovery? Like, how can you rate the recovery? Like, how many weeks, how many days can they take them to maybe go back to work or go back to the kawaida duties that they take on?
Okay. Downtime, I normally give it 2 to 3 weeks. But I've ever done liposuction on someone on a Friday and Monday they went back to work.
Yeah.
Okay? As I said, the only limiting factor to being active is the discomfort and pain.
Yeah.
And that depends on your pain threshold. Actually, the only thing most clients complain about when it comes to liposuction is the pain. Because one, we don't make big incisions. We just keyhole incisions, small incisions. So those ones, taking care of them is not difficult. At Amitak, that one involves a big incision, right? We put it where, and I recommend it to clients, maybe the ones who've had cesarean section before, it becomes quite easy because they already have that scar. But for liposuction, it's keyhole incisions, those ones are easy to take care of. So as long as you're not in pain, you can go back to your routine, as long as it's nothing so strenuous and manual. If you are an office lady, you can go to your office and sit down. I've had clients who run their own biasharas, businesses. And once I discharge them from hospital, and actually I encourage my clients to be very active. Look here, if I come to the hospital bed where you are, and I find a card written "Get well soon," I'll tear it and throw it away, because you are not sick. You just had a procedure. It's like so it may be a congratulatory card.
So you don't call them patients?
No, I call them clients.
Clients.
Yes.
Okay.
Yeah, so they're not patients. They just had a procedure. Remember I said cosmetics, you are okay, we're just making you better. So I should not see something there saying "Get well soon," because you are not sick in the first place. We're just making you better. So you should be congratulating you for taking a new journey. Yes.
But I think those maybe that you find the get well soon, I think there's also stigma around it, kinda, especially when it comes to lipopectomy. That those who feel they don't want to really disclose what's happening. Have you found something like that?
Oh yeah. We are still a conservative society.
Yeah.
Okay. We are still conservative. We are religious.
Yeah.
With some religious aspects to it. Okay. So people are not willing to talk openly about these procedures, but we are doing them. Okay. And because of what I call patient-doctor confidentiality and ethics, I'm not at will to say so and so did it. All right. Actually, sometimes I go to the social media pages and I see the photos. I have that eye. I can tell. All right, but I'm not at liberty to discuss. It could be that I didn't do it. Maybe they went outside the country and did it, but you can tell. Yes. With a keen eye.
Okay. Yes. We also hear wearing garments at
Oh yeah, that's the aftercare. See now, and it's good that you're asking these questions, because I realized some clients, when they come, they are focused on the procedure itself, the surgery. They forget the aftercare, and actually the outcome depends on the aftercare. Remember I said you're not sick, you need to be active, right? You can even wake up, go make yourself tea, right? Do something in the house, nothing strenuous, right? But if you're active, it assists with circulation. And with circulation comes the nutrients needed for recovery, right? So I see my clients who are very active, they recover very fast. To the attitude, all right? I've seen this, right? If a client comes and the first questions they ask me, "Doc, am I going to die?" Straight away I know we may have problems afterwards, because if there's any slight thing that happens, I've had clients call me at 3 a.m. They're like, "Doc, I think I'm dying." Okay, because of anxiety and other issues, the things they read online, right? Clients who have a positive outlook, their outcomes are way better, because I've followed up clients, right? Those ones who tell me, "Daktari," they're seeing on the flip side. This is even one I was discussing. I told them, if you go to the medical board or the medical council, even what's published, the complication rates, this one I may be hanged for it. The complication rates, okay, for cosmetic surgery is around 0.5%. Okay? Complication rates for gynecological issues, obstetric issues can be as high as 30 to 50%. But no one looks at those complications when they want to start a family. Right? But when someone comes for cosmetic procedure, like, I want to know how wrong this thing can be. All right? But I think it's the way our society is. If you go to countries like Korea, You go to countries like Brazil. In Korea, actually, young girls, when they get to like 18 years, their fathers sponsor cosmetic surgery for them so they can get husbands.
Wow.
Yes. So some societies, they've embraced this. We are yet to.
Yeah.
Okay.
Yeah.
But again, as I said, the complication rates are 0.5%, the lowest.
Yeah.
All right. But it's just that if one complicates, it's amplified. All right. And it looks like everyone is
This is
complicating.
what happens all the time.
But we actually get good outcomes. All right. And personally, I thank God, I think I've gifted, and so far I haven't had any crazy complications on it. Yes.
But you must say there.
Oh, there, it's a possibility.
You know.
I don't know about that. I don't want to comment about that. Let me talk about my practice.
All right.
Yeah.
We'll take a short break. When we come back, we'll have Dr. telling us more about this.
2 weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air. Friends and guests joining us everywhere.
Healing hands are strong in the heart of Middletown. Grace Park lights the way, bringing hope to every frown.
Hello, my name is Maureen. At Grace Park, we believe in transparency and communication. As a patient, you have the right to receive respectful and compassionate care, to be informed about your diagnosis and treatment options, and to have your privacy and personal health information protected. We understand that your experience matters. We guide our patients through every step of their healthcare journey, including coordinating appointments, providing emotional support, and ensuring you understand the treatment options. At Grace Park, we go over and beyond to prioritize these rights, to ensure our patients feel safe and valued.
Grace Park's legacy, guiding every flight. Grace Park Hospital echoes through the hall. Grace Park Hospital, answering.
Hello, I'm Jelinda. At Grace Park, patient trust is the cornerstone of our practice. We are dedicated not only meeting their expectations, but also exceeding the standards of the care and privacy. We go over red behold to create safe and supportive environments where patients can focus with their wellness journey.
We value your feedback. It is invaluable in helping us understand what we are doing well and where we should improve to meet your high standards of care. Talk to us via our customer support line that is available to you 24/7 on 0111 053 800 or through our social media platforms.
Welcome back, guys. We're still with Daktari telling us more about liposuction and tummy tuck. And now, Daktari, there's something you mentioned about smoking and the smokers, how you cannot really rush into surgery when it comes to that. If you could tell us why, what's the reason with that? Because there's maybe someone that's their lifestyle.
Oh yeah. Cigarettes, they contain, I think it's nicotine, right?
Yeah.
And nicotine has an effect on blood vessels. It makes them thin, it can make them sclerotic, hard, and so that makes healing a problem. Healing may be prolonged or it may complicate.
Yeah.
So normally what I tell clients, and something I noted with guys who smoke marijuana, I don't want to base it on scientific basis, but I've had clients, we do surgery, we finish, we go home, they go home,
Yeah.
1 week down the line, now they're reporting hematomas. So I was talking about these clients. We did surgery. They went home, and then a week, 2 weeks down the line, they came back with a hematoma complication.
Yeah.
Now, when I tried to ask them what happened at home, I noted that either they had smoked a few weeks before, or they went home and smoked weed.
Oh.
Okay. So generally, smoking is not good because it affects blood vessels, and it can complicate healing. It can show up with a hematoma. A hematoma is when you have bleeding occurring in a closed space, and then it forms a clot.
Okay.
So that's a hematoma.
Yeah.
And it can cause pressure effects. If let's say it was on the breast, it can press on the nipple, and the nipple may necrose or die. Right? So hematomas, and they can cause pain, they can cause anemia, low blood level. So that's why we need to evacuate them as quickly as possible. Yes.
Yeah.
Alcohol itself really, it has to do with anesthesia and even recovery. You can imagine, we've done a good surgery. Okay, you go and drink, maybe you fall. Okay, you injure yourself.
Yeah.
Right?
Yeah.
So and then the other, so that's why we really don't. And then alcohol interacts with the medicines that we give, especially anesthetic medication.
Yeah.
So in theater, the anesthetist has to keep on topping up, medicines to keep you under. All right.
Yeah.
So that's why we really don't encourage people to drink a few weeks before and after surgery.
Yeah.
Yes, it's not an absolute contraindication. Even for smoking, we tell people not to smoke at least 6 weeks before surgery. So if you come today and you say you smoke, it means I can't do surgery until 6 weeks are over.
Yeah.
Yes.
And Dr. There's a part that you mentioned about a client that comes in thinking that they can use maybe lipo tummy tuck to lose weight.
Yes.
That's one of the things that really disturb ladies, especially ladies that have already had their kids and they're trying to lose their baby fat. So what would be your advice on that?
There are many ways of losing weight, but liposuction is not one of them.
Oh.
Okay.
Yeah.
Unfortunately, it's not one of them.
Yeah.
Liposuction is meant to augment weight loss.
Yeah.
Right.
Yeah.
Now, out there are many programs that can teach on weight loss. Right. But the oldest ways of losing weight is diet and exercise. Right. Now, if you're overtly big, right, overweight or obese, the other modalities or the other ways of losing weight. People have gone for gastric balloons. They are temporary. They are placed in the stomach, and then after 4 to 6 months they are removed. But it means that discipline, because they occupy a space. It means you eat 2 spoons of rice and you're full. So it means once they remove that balloon, you must maintain that discipline. Otherwise, if you don't maintain the discipline, the weight will come back. But there are more permanent solutions like sleeve gastrectomy, in that they permanently reduce the size of the stomach. But that's not my area. It's just that if someone comes to me and they are concerned, the main concern is weight loss, then I send them to my colleagues who offer these services. Yes.
And now when it comes to women, especially the most common question that I got when I mentioned that I'll be having as a guest, is there are ladies who are concerned, those that want to do the lipo or the tummy tuck and they don't have kids, or maybe later on they want to have kids. Can you still conceive? Can you still carry pregnancy through even after having these procedures done?
Yes, because we don't interfere with the reproductive system, right? So if with the liposuction or the tummy tuck, you can still go ahead and conceive. However, disclaimer on tummy tuck, tummy tuck, we are attacking the muscles, we are making the muscles stout. We are achieving a good body. Now, if you get pregnant, you'll undo that. So there's no point of doing it. So for the tummy tuck, I recommend it to the ladies who are already done with childbearing, right? But if it happens that we've done the tuck and then you get pregnant, you'll still carry your pregnancy. It's just it will undo what we've achieved. Liposuction is safe. Many celebrities actually do these procedures, even just before, because this is information you can't get out there, and it's off books, all right? If you want to maintain that body, right, that nice body that you have before childbearing, lose some weight before conceiving, so that during the journey of pregnancy, as you gain weight, you go back to the weight you are. Okay. And then after giving birth, it's like who you were before, and then work out your core. So even with liposuction, it can assist to shed off a bit of that fat, so that during pregnancy you regain it and then you get back to what you were. So liposuction is a fair play when it comes to maintaining yourself. As I told you, I have a keen eye. I know what people I apart from my clients, I know, so I can tell, this social media, they post a lot and we see. So liposuction, that one, there's no contraindication to childbearing. You can have it, get your child. Actually, it will help you maintain yourself. Yes.
Okay. And then what are some maybe of the lifestyle changes that one will have to adopt now after doing this procedure?
No, that's a good question actually, because apparently after giving you that nice body, many people get a new, it's called a new leaf. All right, it's like they get this opening in their life to go party, because now you have that body, now you have to show it.
Of course,
but unfortunately, no, that's not how it's supposed to be. Okay, you're supposed to go slow, because liposuction is not permanent, but you're the one to make it permanent. That's what I tell my clients. You have to eat well, you have to exercise to maintain it. Okay? But I have to say this, if you're gaining weight and it has happened, where we've done the liposuction is the last place you'll see fat accumulating.
Okay.
So what normally happens, a client comes and then they're like, doc, my shoulders are broadening, my neck is becoming big, what's happening to me? And I did liposuction. I tell them what's happening, you're gaining weight. It's just that you're not gaining it where we did the liposuction, you're gaining it elsewhere. So by the time you're seeing weight on your tummy, it means elsewhere the face is round, the neck is big, shoulders are broad, thighs are big, and then the last place you're seeing the fat now is the tummy. Yes. So you have to maintain. Yes. If you don't maintain, of course, you'll become big again.
We'll be crucified by boy child if we don't handle this. There's something for the boy child in our office.
Yes, men are not forgotten. Quite an interesting story. This gentleman who came, and he is an MC. He MCs events. Now, people are very specific. They're like, this is the dress code, and this is what you have to wear. So he goes to MC events and he's told this is what you have to wear. He can't fit, so they have to look for some. So he was missing out on gigs. So he's like, doc, is there anything you can do? Because now you see, and again, liposuction is for those quick fixes, right? You do have time, to go lose weight. Because losing weight is something. Over time.
That takes time.
So I did liposuction on him, and he's getting his gigs. Yes. So men come for liposuction, right? Someone mentioned the beard, right? We do hair transplant for the beard. Restoration of the hairline, with the hair transplant. And it's called what? It's called, there's a term I'm trying to look. Bedroom matters, all right? Right? Some want it big and long end. And how do you call it? The girth, So we make it long and big. Yes. So there's a lot for men. Yes. I actually even tummy tuck. I've done a tummy tuck for a man.
For a man.
Yes. Unfortunately, let me put it this way. He had a big hernia, and it was making his tummy hang. So we repaired the hernia, and then we did a tummy tuck on him, and super. Yes.
Wow. That is quite a lot. I'm sure you've gotten all the information that you've been dying to hear. And as we come to an end, Daktari, what do you have to say about BBLs and breast uplift, breast reduction? I think this is a whole topic that we'll have to come again and discuss, but perhaps you could touch on them.
BBL, of course, we do it, but it's more by intense, especially the recovery period. That one, we really need to sit down and discuss with the client of the expectations. It can be quite intense. But it's possible, and it's quite sensitive. I'm yet to establish a team here in Meru so that we do it here. But I do it a lot, in Nairobi where I normally stay. Breast lift, those ones, yes, of course. Especially with ladies who've developed what we call post breastfeeding breast involution. Like literally the volume is gone. So all you have is just a hanging breast.
What you call fallen soldiers.
Yes, those ones. Actually, someone said she called them sleepers. I laughed. Someone, yeah, clients. Some clients are quite hilarious. Yeah, she's like, hey, these are sleepers. Someone said this is she called them choking bags.
Oh.
Like when she sleeps, they fall over the face and they recover. Not my ones. Those are clients who are like, docs, so this one's out, they're really choking me when I sleep. All right, so we address that one too.
Yeah,
yes.
Okay.
Yeah.
Daktari, asante sana.
Karibu sana.
Thank you so much for being here.
Yes, so in Meru, I'm normally here every week.
Yeah.
As I said, I teach at Kenya Methodist.
Yeah, Kemo.
So, I can't teach the whole day. Yes, I have some private time to me.
Yeah.
And so can be found here at Grace Park on Tuesdays. Yes.
That's when you have your clinics.
My clinics, yes. And then from there, if you schedule a procedure, I can spare a day or two.
Yeah.
And spend it here in Meru.
Yeah.
Yes.
Karibu sana Daktari, even to Meru and to, thank you so much even for being our guests at X Living. We'll definitely get you back to discuss more on these things because normally we think that, like how we even laughing about the sleepers and the fallen soldiers, but of course there are those who are really affected even mentally because of this, because, as you're saying, every client varies on the reasons why they're coming in for the procedures. So asante sana for being here. And we are grateful. So guys, I am sure you've learned quite a lot on this episode. Let us know what you think. Let us know what you'd love to know more. We can always get Dr. Mata to answer your questions. And in case of even more queries, booking for the clinics, we'll put the contacts down below and you can call and get all the information that you need. Then again, thank you so much for always tuning in every week. The subscribers, the new subscribers, we really appreciate you. Let's continue liking, subscribing, and commenting. Let us know who you want us to bring in the show. And kama kawaida, may God bless you and see you next week. Bye-bye.
To X Living, where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air. Friends and guests joining us everywhere.
Healing hands are strong in the heart of Meru town. Grace Park lights the way, bringing hope to every frown.
Hello, my name is Maureen. At Grace Park, we believe in transparency and communication. As a patient, you have the right to receive respectful and compassionate care, to be informed about your diagnosis and treatment options, and to have your privacy and personal health information protected. We understand that your experience matters. We guide our patients through every step of their healthcare journey, including coordinating appointments, providing emotional support, and ensuring you understand the treatment options. At Grace Park, we go over and beyond to prioritize these rights, to ensure our patients feel safe and valued.
Grace Park's legacy, guiding every flight. Grace Park Hospital echoes through the hall. Grace Park Hospital, answering.
Hello, I'm Julinda. At Grace Park, patient trust is the cornerstone of our practice. We are dedicated not only meeting their expectations, but also exceeding the standards of the care and privacy. We go over red behold to create safe and supportive environments where patients can focus with their wellness journey.
We value your feedback. It is invaluable in helping us understand what we are doing well and where we should improve to meet your high standards of care. Talk to us via our customer support line that is available to you 24/7 on 0111 053 800 or through our social media platforms.